patient displayed lesion consistent with subtle cotton wool spots that is retinal nerve fiber layer infarcts. As you know, the cotton wool spot can be seen in wide spectrum of the diseases, and actually we should see, I mean, it requires frequent follow-up to see if this cotton wool spot is actually going or not, because as you know, they usually disappear in 6 to 8 weeks, and if it's not, it is just nerve fiber layer myelination, which is not abnormal. And also for further concern, they also illustrated the OCT findings of 3 patients with hyperreflective band in inner retina, to be exact, in inner plexiform layer and inner ganglion cell layer, but it can be also just the inner normal retinal vessels. So to have the accurate interpretation, they actually needed a couple of follow-up which shows the entire volume of OCT images and also registered near infrared images. But of course, their hard work really appreciated, and they just opened another door for further research as far as coronavirus and eye involved. And when it comes to treatment, nobody has much to say, because so far no confirmed treatment, but me, like you, has read in several references. Some of them are saying some antiviral drugs are just prescribing to the patient, or in social media, I was listening to a doctor was telling they are just giving some vitamins to patients or aspirin, and they just result some effect, but none of them are scientifically approved. Thank you so much for your attention and listening. If you have any question, please write it down and I will definitely answer them if I can. Okay. I'm waiting if the question can be delivered to me. What are the primary signs of coronavirus? Actually, in my country, because the coronavirus in Iran, coronavirus is very common now. They are saying if we see any sign of flu, we just put them in coronavirus category. It is like they don't even delay for a second. They just say, oh, that would be coronavirus. So if there is no question, let us just, I'll just say the next speaker. Today, we are pleased to welcome Mr. Pritam Dutta from India. Pritam actually completed his bachelor in optometry from Ridley College of Optometry in India, Assam in 2013. He also completed the master in optometry from Shankar Nethralaya, Chennai in India, again in 2019, and currently working as a lecturer in Ridley College. Very welcome, Pritam. Hi.
Yeah.
Hello.
Hello.
Am I audible?
Yes.
Yeah. Just a minute.
Pritam, I can explain more about you till you are prepared if you want. There are a lot to talk about you.
No, that's fine.
All right.
Yeah. Yeah, is the screen visible now?
Yes, perfect.
Yeah. So a very good evening to one and all present here. So as mentioned today, for the next 15 minutes, we'll be discussing on concussions and the optometric approach towards it. So when we talk about concussions, just a minute. Can you see the slideshow? I'm not sure.
Yes, Pritam, it's very well visible.
Yeah. Okay. Yeah. Yeah, fine. So when you talk about concussions, it is something like a mild traumatic brain injury, which can be caused by an external force, and it causes a disturbance in the cerebral functions. Since we all know that the brain is being involved in some complex neurological functions, and some of them are associated with vision too. So it is very much important to understand the neurological aspects of the brain and its connection to the brain. And it's also very important to understand the changes that has been occurring in a concussion patients following a neurological insults. So what happens in the brain actually is, since it is a mild traumatic injury cases, so there occurs some diffuse sharing and stretching of the axons in the brain level, which are actually responsible for transmitting the neural connections or the neural processing information from one neurons to the another. So when there occurs a diffuse axonal damage, the processing actually delays, and it turns up with various visual and non-visual symptoms. So when we yeah, so there are lots of visual issues that a patient might encounter following in concussions. So I will be talking about them, not each one of them, but the most commonest one that the patient might encounter to you. Yeah, the slide. So what happens is the most commonest causes of concussions would be the blow to the head, any penetration to the skull, or an exposure to a blast, which would lead up to or end up to various ocular complications or consequences like blurred vision, sensitivity to light, visual field changes, headache, or any kind of asthenopic symptoms. And then there would be some reading difficulty associated with the patients too. So these are the most commonest or the wide range of symptoms that a patient might present to you who had a history of concussion. It can be anything that is directly related to the ocular symptoms, or can be an indirect symptoms too. So the main thing is how to approach them. Okay, in order to understand their symptoms, their presentations, you need to understand the in-depth ocular measurements of the patient, so that you would see if there is an ocular involvement underlying for the concussion patients. Yeah. So how do you actually approach them? So the very first component for a concussion patient is a basic optometric vision examination, which is nothing but the visual status determination, the refractive error determination of the patients, the phoric status change if there is any for the patient, and also a proper refractive correction to see if the uncorrected refractive error would not be a trigger